that this was going to be a 6-month stint and we'd be out. And we're actually moving into our 3rd year now. We'll have 2 completed years moving into a 3rd.
Now we see there is no end in sight to this.
ICUs are full and there's more deaths. It's really like we're being just brought back to it. We're back in the beginning.
Trying to balance risk with the job that has to be done is so difficult. It plays on the mind and it plays on the physical.
It's really tough being students as well. Like, you don't get that break. When you go home, you still have to worry about your assignments.
Every day I wear full PPE, but I am every single working day in contact with COVID positive patients.
I'm exhausted. We all are, and we'll be burnt out before we even qualify.
We see the different variants that are coming on board. We see people who are not vaccinated getting exceptionally ill, but we also see vaccinated people without underlying conditions getting unwell.
Pre-COVID, November, December, January, February, were always very challenging and always very submerging in terms of effort required. But throw COVID in there with elective work and emergency admissions and stuff like that, that is just, it is a perfect storm, really.
When you're on placement, the nurses are so overwhelmed at the moment. They're so busy, they don't have the time. If they're short-staffed, you don't really have a choice sometimes. Like, you do have to step up and you do have to take on more patients and more work than you probably should as a student, but it happens. I've
spoken to colleagues and I've seen almost like a blankness or a deadness where you're trying to communicate with them and you know they're listening, but they're just not coping.
A colleague stated to me recently that she reckons her life is shortened by the very trauma of what we faced, especially in the first wave, not knowing, the whole anxiousness, lack of sleep.
If the health, safety and welfare of the employees is not okay, then the health, safety and welfare of the patient is not okay. It cannot be okay.
Coming up to Christmas, I just really, I would love if things could be a bit normal this year, but I'm not really hopeful of it. It's actually my 21st birthday tomorrow and I won't be able to really do much with it. I had plans, but with the increased cases and stuff, I think I might just have to sit it out again. So something like that, it's a birthday and you don't even get that much.
I'm very apprehensive what next year will bring. I'm apprehensive that people doing our job will decide that there are easier ways of making a living and that they're going to leave the profession. And I'm anxious for those that are left behind and being asked to do so much again and again and again.